here with Dr. Joseph Fretta, who specializes in vein treatment, cosmetic surgery, and body contouring. Good morning, Dr. Fretta.
Good morning.
Thank you for having us.
It's a pleasure.
Could you explain a little in detail about the services and procedures that you offer?
Here at New Jersey Vein Cosmetic Surgery Center, we offer all the treatments for varicose veins, spider veins and blue reticular veins, those bulging blue veins that aren't really varicose veins. Those treatments entail something called endolaser ablation of varicose veins, where through a pinprick below the knee or in the mid-thigh, we can thread a catheter in the leg, in the vein of the leg, the varicose vein in question, and turn on the laser. This is a laser catheter, and as we pull this laser catheter out, we're cauterizing the vein and closing it down. So this is completely ambulatory, no general anesthesia is required, and the patient can return home driving on their own right after the procedure. Another treatment for spider veins is sclerotherapy. That's using hair-fine needles to inject away the little spider veins. Again, it's essentially a painless procedure. Feels like little mosquito bites, not a bee sting. And we can eradicate all the veins that way. Another procedure that we do is called ultrasound-guided sclerotherapy, when they have larger veins, but they're not varicose veins and they're deeper in the leg. Using an ultrasound machine, we can visualize the veins deeper underneath the skin, underneath the TV monitor, and guide needles to those areas and inject those veins away. So in doing so, we reduce the heaviness and swelling that people have from venous insufficiency or varicose veins, and improve the appearance of the leg simultaneously. As a nice aside to those treatments, my patients told me, "Gee, doc, not only did you get rid of all my little spider veins and blue veins, but my legs are slimmer now."
Really?
Yeah. So it dawned on me, this is years ago, that one of the causes of the cottage cheese that people get, that they call cellulite, if they're not addicted to Dunkin' Donuts and eating wrong, but the people who exercise right and do everything right but still get the lumpy bumpies, is the fact that they have these nests of venous insufficiency in their legs. And using loupes that illuminate the skin so we can see the underlying vein, you can see the veins underneath the skin that engorge with extra fluid, a backwash of blood, and the water component in those veins seep through the walls of the veins, and that water is absorbed by the fat cells, and that's what gives everybody that lumpy effect.
Interesting. I never heard that. Treatments do you offer?
One of my favorites is this new technique that's been out for about 2 years called Smart Lipo. That and another machine called Shazer Lipo, when used in conjunction, blow away the old liposuction and tummy tuck. Number one, it's ambulatory. You can have your treatment. These treatments take about 4.5 hours, but you're rested. We take care of you, reshape your body, whether it's underarms, abdomen, hips, thighs, and after the treatment is done, you're wrapped and you're free to leave. You can drive home on your own. And because we're using these different catheter probes that we're inserting through a tiny little nick underneath the skin to melt away fat and tighten skin simultaneously, there is minimal bruising, because the heat of the catheter, whether it's the laser catheter of a Smart Lipo or the ultrasound catheter of a Vaser Lipo, they generate heat and cauterize the blood vessels as they're melting away the fat and tightening the skin. So in the hands of someone who has a good concept of contouring people, you can really reshape people and give them back a nice silhouette. And it's great. I mean, I've had women who had 4 children that I've been able to recontour again, and they can wear a 2-piece bathing suit again and not have the scar of a tummy tuck.
And the effects are permanent?
And the effects are permanent.
That's fantastic. And what about cost? Is it comparable
to... It's a lot less money than a liposuction and tummy tuck. Those costs usually run into the $12,500 range. These procedures run in the $4,000 to $5,500 range. And the nice thing is, the next day you're ambulating. You can go to the gym and walk a treadmill. You're not out of action for 2 months where you would be with major surgery. and you can return to work the next day, household chores and everything.
I
Swelling.
understand that you offer various fillers and facial procedures. Can you explain what those are?
You know, everybody in America likes to get Botox these days, and I like Botox. It's easy. I'm adept at anything using a needle because I can inject the tiniest little spider veins, even veins around the face. So injecting Botox is just an extension of my practice. The other thing that we do is we inject a lot of the fillers. I like embellishing lips, but I don't want to make anybody look like some of our famous or infamous starlets.
Who shall remain
Huge lips.
nameless.
I like to give people a nice, natural look, just a little bit of embellishment. And in using fillers, my favorite fillers are Radiesse, which is a thicker filler, Restylane, which I use on lips, and Juvederm Ultra Plus, which I also use on lips. You know, we'll inject the nasolabials, a little lip embellishment, number 11 lines. And I like using fillers, injecting along here from this area toward here, and then pulling the needle back as I'm injecting to plump up the cheekbone area. Because as some people age, they get plump and pouty looking, and other people get drawn and gaunt.
Right.
So fillers do come into play. Now, when you're in your late 30s or early 40s and you need just a little tweak, that's where Botox and fillers really come into play. If you are older and have more rigors of age, that's when these other procedures like smart lipo on the face comes into play. First, tighten the skin, then see if you have to do something else to embellish to give a more youthful look.
Now, as far as the fillers go, how long do the effects last?
Different fillers last different time periods. I mean, you can use a lot of fillers that are, quote, permanent, but permanent really is about 5 to 10 years. Those fillers are nice, but I don't know how the rest of your face is going to go 5 or 10 years from now. So I'd really like to use something that has a year-long effect. And Radiesse lasts about a year. If people are really, you know, educated in what they want, and you know, then I'll use a longer acting filler. Otherwise, I always suggest use something that won't last longer than a year. This way, if you're not happy with the look, it's not permanent.
Exactly. And what about cost?
Cost, we don't charge as much as a lot of other people charge on the fillers. I charge $685 for the Radiesse, and you know, other people charge as much as $880 for a syringe of Radiesse, and I charge $575 for the Restylane, and about the same for the Juvederm.
Wow, very
You know, so
reasonable.
I try to keep it reasonable because I know these aren't permanent things, and you know, keep it reasonable, keep people looking good, and they'll come back for more treatments.
Absolutely.
I like to build relationships with my patients.